years since actor and comedian Robin Williams died, but new details shared this week by his widow are calling attention to a form of dementia that has received little public focus until now. William Brennan has the story.
After Robin Williams took his own life, his press representative said Williams was battling severe depression. His widow, Susan Schneider Williams, also said back then that he was struggling with depression and early stages of Parkinson's disease. But this week, Mrs. Williams told ABC News and People magazine that an autopsy revealed something else. He had what's known as Lewy body dementia. She described battling a mysterious set of symptoms for a year, something she compared to playing whack-a-mole. Quote, "They present themselves like a pinball machine," she said. "You don't know exactly what you're looking at. I've spent this last year trying to find out what killed Robin, because we didn't know. He didn't know." Joining me now to help us understand more about this disease is neurologist Dr. James Galvin. He's a professor and associate dean for clinical research at Florida Atlantic University. Dr. Galvin, thank you for joining us. It seems that before this news about Robin Williams broke, most of us had never heard of this disease. Can you tell me a little bit more about it?
Sure. So, Lewy body dementia may be the most common disease you've never heard of. It's the second most common cause of memory problems after Alzheimer's disease and affects over 1.3 million Americans. Its predominant symptoms are a progressive change in memory and other thinking functions, signs of Parkinson's, so slow movement, stiffness, balance problems, visual hallucinations, seeing things that aren't there, like little people or furry little animals, fluctuations in levels of attention, concentration, and lastly, a sleep disorder where people act out their dreams.
Among that huge array of symptoms, I'm curious about the particular visual hallucinations you described. Is that common for a certain type of dementia to have such specific hallucinations?
It's very common in Lewy body dementia. Typically, if other dementias, other memory problems develop hallucinations, they're not so much later in the course of the disease, and the hallucinations are not so well formed. What's particularly characteristic of Lewy body dementia are these very well-formed hallucinations. They're usually not frightening initially to the patient, but they are very well-formed. They usually can describe exactly what they're seeing.
Is it partially because it sounds like the symptoms seem to mimic Alzheimer's and other diseases? Is that why this is such a difficult disease to diagnose?
That's exactly why. Early on, some of the symptoms may mimic other diseases like Alzheimer's disease if it's just the memory problems, Parkinson's disease if it's the movement problems, or a psychiatric disease like schizophrenia if it's the hallucinations. It really takes an experienced clinician to be able to put all the pieces together and come up with the diagnosis.
So is this a degenerative disease, and is there any cure? I mean, does it just get worse, or is there any prognosis that's a hopeful one?
Well, it is a progressive degenerative disease, and we do not have a cure for it yet. We can effectively treat many of the symptoms of the disease using medicines for other diseases. So, for example, we can use the medicines that are used in Alzheimer's disease and Parkinson's disease and schizophrenia to treat the individual symptoms. But I think it takes a very careful, individualized approach to decide which is the best regimen of medicines for each patient.
Robin Williams' widow described battling these symptoms as akin to playing the game whack-a-mole. Is that similar to what you've heard from other patients, that it's this very mysterious, hard thing to pin down? You just don't know what's coming at you?
It can be very mysterious and very difficult and challenging for the patients and the families and for the clinicians, frankly. As the symptoms begin to appear, it really takes a while to kind of sort out what's going on. With the Lewy Body Dementia Association, we had conducted a survey of over 950 caregivers to try to understand the diagnostic experience. And what we found was up to an 18-month delay with patients seeing multiple doctors over multiple visits before finally getting a correct diagnosis.
I understand that there is some question about whether people who suffer from Lewy body dementia might be more at risk to harm themselves or to commit suicide. Well, can you tell me a little bit about that? Why would that be, and is that true?
Well, there's no evidence that any of the dementias, Lewy body dementia or Alzheimer's disease for that matter, by themselves increase the risk of people committing suicide. Now, for some individuals, when they hear they have a chronic disease and they're trying to deal with the chronic disease, and maybe the diagnosis isn't given or isn't correct at the time, and their symptoms aren't responding, people can make decisions to harm themselves. but the disease itself is not associated with a higher risk of suicide.
I see. So looking forward, I mean, is there any optimism that we're at the cusp of a treatment for this type of a disease?
Well, I think there's great room for optimism. We know more and more about the disease. We understand more and more about the abnormal proteins that aggregate or clump together that cause the changes in the brain. And so now this is a beginning to allow us to develop medications that may have some effect. Very recently, several companies have made announcements that they're beginning specific clinical trials to treat Lewy body dementia, and these would be the first medicines specifically indicated for treating Lewy body diseases. So I think there's great optimism. I think it's important that patients remain hopeful and families remain hopeful and stay engaged and advocate for their loved ones so that we can get more research funding to develop new treatments.
All right, Dr. James Galvin at Florida Atlantic University, thank you very much.
We are now going to talk about Erik Erikson's theory of psychosocial development. Erik Erikson's theory of psychosocial development identifies 8 series of stages, which make up the healthy way the individual develops and the way they progress from infancy to late adulthood. The stages are present at birth, but begin to show as the individual progresses and develops through their social and cultural upbringing. Throughout these stages, the person learns to master and experience challenges. The continued progression into the next stage successfully depends on how the individual completed the stage before. If the stage prior was not completed as expected, they may begin to see future issues arise as they continue throughout their development stages. The stages are set up and characterized by the crises that each individual may experience at that given stage. As we get older, we by nature tend to slow down and begin to reflect on our accomplishments. As we do, we develop integrity. And as we see ourselves as we lived a successful life, we look back through the years at the achievements we have had. We look back with great satisfaction. As an older adult, it is often hard to look back and think to ourselves, should I have done things differently? Was I happy in my marriage? Could I have been more successful? Yet that older adult still has the fulfillment of their continued life ahead in their health. Yet with the patient who suffers from dementia, they may see that this is at the end and begin to have feelings of regret. This falls into the category of despair. They looked at their lives as they were unproductive. They were not able to accomplish all their goals that they had set out for themselves as they progressed through their debilitating disease. This is why so many patients with forms of dementia are grappled with depression. This leads us into our next video, which we are about to watch, the introduction of the 5 stages of grief.
Described by my co-author Elizabeth Kubler-Ross are denial, anger, bargaining, depression, and acceptance. She first identified them in 1969 in her book On Death and Dying. And the stages have now become as legendary as she is, and they are very well known and commonly used by many people to identify milestones that we go through in grief. But as she always said, those stages are as individual as we are. We're all going to go through them in different ways. They don't have to be linear. You don't have to have 1 month for each stage. And some people may spend more time in anger and less time in depression, and they're very different. We always say one of the biggest misconceptions is that we have to follow the stages, where the truth is the stages reflect where we are. So just do your grieving, and you may notice from time to time, oh, I'm in that stage. But just know it's not a prescribed formula that you have to do. It just helps you normalize where you may be. And you may go through the stages more than once.
I will next talk about Kubler-Ross's theory of death and dying. Stage 1, denial, which shows trouble accepting the fact of death, diagnosis, or a new reality. This is the inability to do usual activities. Second, anger. Anger at yourself, others, professionals, particularly doctors, life. This leads to feeling helpless, powerless, and abandoned. The third stage, bargaining. Making deals with God or friends, hoping to change the situation. This leads to thinking about what could have been or what should have been done differently. The fourth, depression. Feeling overwhelmed with loss and change, sadness, regret, fear, and anxiety. Leading to loneliness, isolated feelings, self-pity, empty, and loss. And last, acceptance. Adjusting to the new reality, starting to move on. A sense of hope, healing, and integration. Lastly, I'm going to speak on social workers and their contributions. Social workers and their ability to make a difference when working with the patient and the family involved. When a loved one begins to see the cognitive changes in the person closest to them, it can be heartbreaking. Coming to terms with the fact that the person will deteriorate right in front of your eyes can be more than most can bear. At first, people don't realize that they have dementia. They have brushed it off as though these are symptoms of old age. The realization is much scarier than that, and this is why having the assistance of a social worker or clinical aid is more than beneficial. It is imperative. The toll that the disease takes on the caregivers is at best exhausting. Patients need round-the-clock care, and most feel that they can provide that care themselves. They soon find out that they may endanger the patient as well as themselves with the lack of knowledge that most have with regards to dementia. Creating a new normal is what is necessary. To inform the family as much as possible of what is happening, what to expect, and what the patient needs from them. They are confused and inside just as frustrated as you are. Having the entire family on the same page is essential with the success of dealing with the disease itself and the various behaviors that the patient will develop. Having a complete understanding of where everyone stands in the family and where the support is coming from is a must. Even though the patient will develop a cognitive decline, it is important to not forget who they still are. They may behave differently, but they are still the same mom, dad, grandma, grandpa that you love so much. Continue to do what they love. Studies have found that the sound of music is always a constant enjoyment of dementia patients. They may or may not remember the composer, artist, or singer. They will remember the joy that the music itself brings them. Try and focus on the time that is remaining and enjoy every moment you have with that person. Lastly, I'm going to talk about and show you my last video. It's only about a minute, but you thoroughly will enjoy it.
Do you know you're my mama? You do? A while ago you said you didn't know you're my mama. Well, you act like my mama. Act like your mama? I'm saying you're my mama. I'm your mama? Yeah. All right, I'll be your mama. Now, do you think that I would lay here with just anybody? No. I think you want to have to love them if they want to. Yeah, you do have to love them to lay down with them like that. Yeah. And I love you, Mama. I love you. But do you know who I am now? Who? Kelly. Yes, Mama. Yes, I am Kelly. Well, I love Kelly. And didn't I name you Kelly? Yes, you did. Well, I love you, Kelly. I love you, Mama. I thought a while ago you didn't know who I was. I know it well. It was something because when I have some fears, I get here and I'm thinking, my Lord, what in the world am I thinking about? You are? Yeah. What are you thinking about right now? Well, I'm loving you. I'm loving you too, Mama. Oh, well, we're both doing the same thing. Yeah, we are. Oh, isn't it wonderful? Yes, it is.
Thank you so much for viewing my presentation, and I hope you all learned as much as I did out of this project.